It's the March 2024 show with Braden from Advantage Athletic Therapy, which is located at
381 Cedar Street.
You moved. And Paige was telling us all about it last month. You guys sound excited. How's the new building going for you? Do you like it?
Absolutely fantastic. It's a great atmosphere. Lots of different practitioners kind of bounce ideas off each other, refer in and out. And then, of course, like the great yoga space through Seiza. And all I've had is rave reviews from patients and anyone that's came through.
Have you been trying your yoga? How's your downward dog?
I have not personally got into a class yet. I've been getting prompted for that quite a bit. So my next break, I think I'm going to take in one of their lessons.
Cool. Yeah, my wife does yoga for years. She loves it. She's in great health. The flexibility, right, is an important aspect of it. So she enjoys that. I got 2 words today, and I'm kind of confused, and I need some advice. And I just want you to break this down for folks because tendonitis and inflammation. I know I'm hearing inflammation with everything these days, and I don't really even understand what it is anymore. So, and the tendonitis part, because I keep hearing that as you're getting older, maybe the inflammation is occurring, so you're getting more of this tendonitis. Can you talk to this? I know it's more wrist, elbow, knee, ankle stuff, isn't it?
A little bit of everything, to be honest. When we think tendonitis, anywhere in the body where tendons are, which are the ends of muscles, that basically sums it up as everywhere in the body. Now, itis means inflammation. So whenever you hear the word tendonitis, think that tendon is inflamed. It could be from a variety of reasons. Usually, itis, like that inflammation, is an overuse injury. So like tennis elbow or golfer's elbow, those are like epicondylitis. So that's like a portion of our body where we have a bunch of tendons attaching, gets inflamed, becomes the itis. Then also other types of inflammation, like if you sprain your ankle and it blows up, that's inflammation as well. Not like there's no tendon going on there, though. If you sprain your ankle, it's a ligament and they can also become inflamed. And then that's what's going on there with the swelling that you can visually see. But not all of it can be seen with like the naked eye. You can't always look at somebody and be like, they have tendonitis, but you can see somebody's sprained ankle and be like, that's inflamed.
Does it come back? Like, I mean, I remember years ago, old hockey injury, broken ankle. I always had trouble, right? And just all of a sudden I'd step off a curb or something the wrong way and it'd just blow up. It wasn't broken again, but it was that inflammation, I guess.
And that could be disruption to a couple different things. It could be like as you moved, it could be like the joint capsule itself, something shifting quickly out of place, in and out, and not like a dislocated bone,
Right.
or a joint, but that can definitely reoccur and it's more prone to. Actually, we have a practitioner in our building now that is a lymphatic drainage specialist, and she's a fantastic person to go see for more systemic inflammation, like you've maybe heard with like dieting and poor food
Right.
choices causing inflammation, and she would be a perfect person to go see.
Okay,
Is
cool.
that the lymph connection?
So when we're talking about that, and you used some sports analogies, but a lot of that happens in gardening. Like you
Yeah.
said, you repeat it, you get out, you start doing those springs here, right? Is March show. Everybody's gonna be starting soon, cleaning up messes and getting out in the garden. So what can you do? Is it just the old elevation ice? Is there stuff that you guys can do as well?
So yeah, definitely. Like typically when it first happens, that's like it's going to be like, well, stop using it. Easier said than done, especially if it's something on your elbow. So then anytime you're on the keyboard or you're on your phone, you're driving, like you're gripping, you're utilizing those muscles. In terms of like preventing it or preventing a re-injury, strengthening, proper stretching, and trying to work on the mechanics. So if you have something that's recurring all the time and it's all, like lateral epicondylitis, and you're working through all your musculature, if you don't address the problem, and you're just letting it kind of heal itself, like you're more prone to have it rehappen or reoccur. Sorry.
Is that the same thing? I know you mentioned this probably 6-7 months ago. You and I talked about this, but folks looking at their phone, does that sort of a form of it? Because they're
In a sense,
constantly
yes.
looking down.
It's like a repetitive stress,
Right.
and in that case, maybe not necessarily a tendonitis, but they are finding in kids that are like 13 to 14 that are always on their devices or have been since they were born. It's starting to become like calcification of the tendons, which is even like on a further note where it's like almost irreversible damage. So that's where we have to be really conscious about that forward head carriage, because it's just like holding that bag of groceries. If you hold it tight to your body, not that bad. That's like the pressure of the muscles or the pressure of our head. But as we start to lean forward, the more we start to lean, it's like holding that grocery bag out in front of us. Now all of a sudden that bag's a lot heavier as it moves away from our body.
So to wrap up inflammation, basically, like you said, you're going to rest it, ice it, but if it continues on to come see you guys?
Right. And inflammation, we don't always want to think about it as a bad thing. It's not necessarily just bad. When we sprain our ankle and we see that inflammation, what that's helping is kind of getting some of the debris and the bad stuff away from the area as well.
Yeah.
So slowing down inflammation right off the start is something that we're like, yeah, we want to do, and we want to control it. We don't want to let it get out of hand, but inflammation is required for tissue repair and injury to like improve.
And is it, like we talked about earlier, it can turn into long-term problems, can it?
Exactly. And like if you ever like what we would call is like pitting edema, if you were to like see like a spot on your ankle, it's been there for months, and you push your thumb into it, leaves like a little indentation or like looks like a donut afterwards. That's something that it's like of a chronic inflammation and not going to have the benefits of like an acute inflammation, which would be like early onset at the beginning of an injury.
So what are you saying about my belly?
Sorry?
What are you saying about my belly? Doughy? I'm doughy? Is that what you're trying to? I got inflammation in my tummy? Come on.
Chronic inflammation, yes.
Oh,
Yeah.
all right. Well, on that note, young man, I will let you go and get to work at where's your new location again?
381 Cedar Street.
Advantage Athletic Therapy. Thanks for doing this today.
No problem. Have a great day.